Welcome back, everybody. Heart disease remains the #1 killer of men in America. The good news, though, is that many cardiac events can be prevented, and recognizing the early warning signs could actually save your life.
So this is Men's Health Month, and we wanted to bring in an expert to help everyone out there with Dr. Vipul Madhwani with Baylor Scott White. Thank you so much for joining us today, Doctor.
Thank you for having me.
Let's start with why men are at risk.
So I'll just start off with some stats. Cardiovascular disease is the leading cause of mortality in both men and women in the United States. 1 in every 3 men dies from cardiovascular disease. Cardiovascular disease tends to impact men 7 to 10 years earlier than it does to women. There was an interesting study that was published earlier this year that tracked individuals for almost 34 years that showed the incidence of cardiovascular disease was 5% 7 years earlier in men as it was for women. So they looked at a lot of factors, including the social factors, the behavioral factors, and the clinical factors in trying to distinguish whether one of the factors are playing a role, but the sex disparity still persisted even after taking into account for these risk factors.
And did the study, or do we know why that may be, why men are seeing these incidents earlier?
Yeah, so traditional or the prevailing wisdom has been that men tend to smoke more often, they tend to drink more alcohol, they tend to seek less healthcare professional advice as compared to women who would seek a healthcare professional during the childbearing age, and they tend to have a better diet and lifestyle. But this study, as well as some of the other studies, proved that when they accounted for all these co-founders, they did not see any difference. So obviously there's more to that. Okay. Some of the common reasons that they have explained, first one being the hormones. Women predominantly have estrogen and progesterone, which is protective to the lining of the blood vessel. Men, on the other hand, have testosterone, which after the age 35 starts to decline a little bit, and it does not confer the same protective effect which estrogen and progesterone does. Second factor is lipids. Women tend to have higher concentration of HDL, which is protective as compared to men who have more of LDL and apolipoprotein A and the lipoprotein B, the bad cholesterol, which tend to increase the atherogenic risk and increase the risk of cardiovascular mortality earlier on. Third factor is men tend to have more abdominal fat, which is more atherogenic. It promotes more inflammation. It increases insulin resistance, which increases the risk of diabetes and hence increased cardiovascular disease. Women, on the other hand, they tend to have more fat in hips, which is a little bit more protective and does not induce the inflammation which the abdominal fat does.
Wow. Okay. So, doctor, so many men who are watching right now, they're thinking, gosh, I have so many things working against me. So what do I need to look out for so I make sure that I tackle this before something bad happens?
Yeah. Typically, when you think about chest pain, you have an image of an individual with hands clenched on his chest, complaining of chest pain. But there are a lot of signs and symptoms that start early on. Increased fatigability, inability to do stuff what they were doing earlier, more shortness of breath, pain in leg, erectile dysfunction in men, which is also a canary in a coal mine, as it tends to occur 3 to 5 years preceding a cardiovascular event. These are some of the common signs that I educate my patients to look out for.
We were joking earlier, in case you just joined us, about the McDonald's fried apple pie. But talk about things that men can do to try to lower their risk before those symptoms come on the scene, whether that's diet, exercise, screenings.
So heart disease happens and progresses over many years. So this provides us as a window of opportunity to implement strategies that can reduce the risk. Some of the common risk factors include hypertension. So checking your blood pressure regularly, making sure that blood pressure remains below 120/80 is important. 1 in every 2 individuals in US tend to have high blood pressure. Diabetes, elevated cholesterol levels, exercise. Usually the recommendation is to do 150 minutes of moderate intensity exercise or 75 minutes of high intensity exercise. Adequate sleep, which is important. 9 to 11 hours of sleep.
Wow.
And then I think working on stress. Those are some of the important risk factors that if you lower them down, it will improve your cardiovascular health.
Hear all the time about how more sleep helps you when it comes to your health. It's always nice to hear it from a doctor say that as well, because 9 to 11, is that what you suggest we should get?
That's the recommendations
The
from
recommendation.
American Heart Association.
Okay, well, it's coming from the Heart Association,
Yeah.
then obviously there are lots of studies behind it.
Yeah.
Dr. Madhwani, thank you so much.
No, it's an absolute pleasure to be here.
We always appreciate it. Okay, we'll be right back after the break with more of your news headlines and another check on your forecast.